Bipolar disorder is a brain disease that causes people to fluctuate between extreme highs and lows. The highs are called mania and the lows are called depression. And it sort of goes from extreme mania to what we call hypomania, which is moderate to mild mania, and then there's a normal mood, and then mild to moderate depression to extreme severe depression. Since there are two poles, the manic part is it's characterized by sort of increased energy, activity, and restlessness. They have a sort of excessively high, overly good, euphoric feeling. It's often hard because they don't feel like, the individual doesn't feel like there's anything wrong. They just have, all this energy. They stay awake for days. They have these ideas, and they get really passionate about things, and they have inability to concentrate, poor judgment, often characterized by spending sprees and increased sex drive. It can be sort of lead to provocative and aggressive behavior. It's sort of just an overabundance of energy that can keep you from being able to focus on the things that you should be focusing on. And then there's also the depressive side, which is more familiar to people, which is excessive sadness and just empty mood, maybe anxiety, feelings of hopelessness and pessimism, a loss of interest in activities that were once enjoyed, sleeping too much, maybe chronic pain, or feelings that aren't really based in physical injury or ailment. And then, of course, at the very end is suicide and severe depression. It generally presents in late adolescence, early adulthood, but you can start to experience symptoms later in life as well as earlier. But that's the general time, is late like teens and early 20s. Yes, it is hereditary, and that's one of the factors in diagnosis, is if you have a family history with bipolar disorder is a big factor. When you have dramatic mood swings, it obviously can affect your relationships, your ability to perform in school or at your job. It would be hard to have a relationship with someone who is abnormally shifting from mania to depression, and I think that it would over time just affect your relationships more and more, and just in depression it's difficult to get things done and to function normally, and so you could lose your job, or just become weary of the cycle, and then eventually to suicide.